Bismillahirrahmanirrahim. Welcome, dear students of first year MBBS, DPT, and BDS. This lecture number 4 is about the volume changes, electrocardiogram, and phonocardiogram during cardiac cycle. In this lecture, you will learn volume changes in the ventricles, jugular venous pulse, also called jugular venous pressure, the production of heart sounds, the origin of different waves of the electrocardiogram, and you will also be able to know about very important concepts, that is preload and afterload. As we have discussed in the previous lecture, that the cardiac cycle is composed of two phases: diastole, in which the filling of ventricle occurs. The second phase is systole, in which ventricles contract and eject blood. So these two phases, diastole and systole, they are divided into different phases. With the beginning of ventricular systole, that is isovolumic contraction, the left ventricle is full of blood, which is called end diastolic volume. And it is about 120 mm of 120 milliliters. With this volume, the ventricles start contracting, or they start their contraction. So the first phase of systole is isovolumic contraction. In this phase, after filling, the volume is 120 milliliter of mercury. In this phase, the volume remains the same as all the four valves, they are closed. All four valves means mitral, tricuspid, pulmonary, and aortic valve, they are closed. So after filling, the volume, that is 120 milliliters, it remains the same during this isovolumic contraction. The second phase is ejection phase. During this phase, 2/3 of the volume is ejected in the rapid phase, while 1/3 of the volume is ejected during the slow ejection phase. We are talking about the volume changes, especially in the left ventricle. So when the ejection phase is over, the third phase starts, that is the isovolumic relaxation. So during isovolumic relaxation, both atria and ventricles relaxes, volume remains same, pressure decreases, and this is shown in this diagram, that the volume remains the same as again the AV valve and semilunar valves closes. After isovolumic relaxation, when atria and ventricles relaxes, the pressure in the ventricle becomes less than the atrial pressure, and also to the as compared to the pressure in the superior and inferior vena cava. So the rapid filling of ventricles occurs during this phase, and 2 by 3rd filling occurs during rapid inflow phase. Then the next stage is diastasis, in which slow filling occurs and only 10 to 15% increase in volume occurs. After that, as you can see from this diagram, the atrial contraction occurs, and with atrial contraction 25 to 30% of blood enters into the left ventricle and also into the right ventricle. And after atrial systole, again the volume in the ventricles, it becomes 120 ml of blood. After atrial systole, again all the 4 valves become closed. 2 of them are already closed, means semilunar valves are already closed, and after atrial systole, AV valves also closes, and volume again in the ventricles, it reaches 120 ml of mercury. With this, the next phase of the cardiac cycle, it starts. Volume pressure relationship forms a loop that is called the volume pressure diagram of the cardiac cycle. For assessing normal function of the left ventricle, it is divided into 4 phases. The phase 1 is period of filling. During this phase, the diastolic pressure, this is the intraventricular pressure, and this is left ventricular volume. During this phase, the diastolic pressure within the ventricles, it remains near 0 mm of mercury, and ventricular volume of about 40 to 50 milliliters is present in the ventricles. So during this phase, this 40 to 50 milliliters is the amount of blood that remains in the ventricles after the previous ventricular contraction and is called the end systolic volume. As venous blood flows, as valves open and venous blood flows into the ventricles, the ventricular volume starts increasing, and during this phase 1, that is period of filling, the ventricular volume it becomes 120 to 130 milliliters. Then is the phase 2, that is isovolumic contraction. During this phase, as you can see from the diagram, the volume remains the same, but the pressure increases. The volume remains the same, but the pressure increases. The pressure inside the ventricles, it becomes equal to 80 mm of mercury. It becomes equal to 80 mm of mercury. That is the pressure in the aorta and depicted as line 2 in this volume pressure diagram, and this is also shown here. Now at this point of 80 mm of mercury, the aortic valve opens and the period of ejection starts. During the period of ejection, that is phase 3, as shown in this diagram, here the aortic valve opens and this is called period of ejection. During this phase, the volume of blood is ejected out of ventricle, left ventricle, because of increase in pressure in the left ventricle even higher than 120 mm of mercury. Even higher than 120 mm of mercury. As you can see from the both diagrams. After ejection, again the volume in the left ventricle decreases and it again becomes 40 to 50 ml of volume again becomes 40 to 50 milliliters. This is the end systolic volume, means the volume that remains in the left ventricle at the end of contraction. Then comes the phase 4, and this phase 4 is called isovolumic relaxation, and during this phase the pressure decreases while volume remains same. So during isovolumic relaxation, the volume again decreases and it becomes 40 to 50 milliliter of during cardiac cycle. Changes also appears in the veins that are labeled as jugular venous pulse, and it is also called jugular venous pressure. Jugular venous pressure is the indirectly observed pressure over the venous system via visualization of internal jugular vein. It can be useful in the differentiation of different forms of heart and lung diseases. Jugular venous pressure are the jugular venous pulse shows three positive waves: A wave, C wave, and V wave, and two descents: X descent and Y descent. So the first wave, that is A wave, it appears when right atrium it contracts while the tricuspid valve is open and the right atrium empties its blood into the right ventricle. And this phase is called atrial systole. And during atrial systole, the A wave in the jugular venous pulse it appears. Large A waves that occurs in case of tricuspid stenosis means when the tricuspid valve is narrow or is closed or due to pulmonary hypertension. Large prominent A wave appears and these waves are then called as Cannon waves. Then is the C wave. C wave, it appears due to bulging of closed tricuspid valve into a right atrium at the start of isovolumic contraction. So, this isovolumic contraction phase is related with the C wave in the jugular venous pressure curve. Then is the third wave, that is V wave. The V wave is produced during later stages of the ventricular systole when the right atrium continues to receive blood. Right atrium receives blood while tricuspid valve is closed. Then is the X descent. The X descent, as you can see, it occurs when the ventricular systole results in pulling the tricuspid valve downward along with simultaneous relaxation of the right atrium. The Y descent or diastolic collapse or diastolic collapse occurs when tricuspid valve is opened and a right atrium emptying occurs into a right ventricle. A slow Y descent suggests an obstruction to right ventricular filling as occurs in tricuspid stenosis. Then is how we visualize JVP. The patient is positioned at a 45-degree incline or angle, and the filling level of the external, this is external jugular vein, and the filling level of external jugular vein is determined. The internal jugular vein is visualized when looking for the pulsations in healthy people. In healthy people, the filling level of jugular vein should be less than 4 centimeters vertical height above sternal angle. A man with this diagram shows a man with congestive heart failure and marked jugular venous distension. External jugular vein is marked by this arrow. How this jugular venous pulse is differentiated from the carotid pulse. There are three ways. There are three important ways by which we can differentiate this JVP from the carotid pulse. The first one is that the JVP is multiphasic. Multiphasic means it beats twice. One during atrial systole and second, the first is during atrial systole, while the second beat it represents venous filling of a right atrium. The second method is that JVP is non-palpable, while the carotid pulsations in the neck can be palpated. The third method is that the JVP is occludable. If one feels a pulse in the neck, it is generally the common carotid artery. If the JVP can be stopped by occluding the internal jugular vein here, one can see that then the internal jugular vein it fills from above. JVP is clinically very important. Raised JVP with normal waveform indicates fluid overload, decreased heart rate, raised JVP with absent pulsations, indicate superior venal cave syndrome. Large A wave indicates tricuspid stenosis, right heart failure, pulmonary stenosis. Stenosis means nerving or occlusion. Then large A wave means Canon A wave. It indicates atrial flutter, premature atrial rhythm, and third degree heart block. Electrical changes in the ECG appears in the form of waves that are called electrocardiogram. So the first wave is the P wave and it appears during atrial systole and it marks the depolarization of the atria and atrial contraction. Then is Q R S complex and it appears due to ventricular depolarization. Then is the T wave and it appears due to ventricular repolarization. Last event that occurs in the cardiac cycle is phonocardiogram. Means the appearance of heart sounds. When listening to the heart with a stethoscope, one does not hear the opening of the valves because this is a relatively slow process that normally makes no noise. However, when the valve closes, so the first valve that closes before systole is aortic valve. So when it closes, the veins of this valve and the surrounding fluid vibrate, that is heard that is heard as sound and this sound travels in all directions. In all directions through the chest. When ventricles contract or they start to contract, one listens a sound that is called first heart sound, and that appears due to the vibrations produced by the closure of the AV valves. The vibration pitch is low and relatively long lasting. When the aortic valve closes and pulmonary valve closes, then appears second heart sound. Then appears second heart sound, and one hears a rapid snap. One hears a rapid snap because these valves closes rapidly. Then is the third heart sound, and this third heart sound it occurs during the middle third of diastole. Then is the fourth heart sound, and the fourth heart sound it appears when atria contract during atrial systole. So, at the end of this lecture, we are talking important key concepts. The first one is the end diastolic volume. It is the volume of blood that is present in the ventricles after filling. And this is the volume that amounts 120 to 130 milliliters, and it is the volume with which the ventricles begins to contract. Then is the end systolic volume. End systolic volume is the volume in the ventricles left after ejection, and its amount is 45 to 50 milliliters. Then is the stroke volume. It is the amount of blood pumped by each ventricle in one beat. And cardiac output, it is the volume of blood pumped by ventricles in 1 minute, and it is determined by multiplying stroke volume with heart rate. The value of stroke volume is about 70 to 90 milliliters. Then is the preload. Preload is very important for understanding the heart function. It is the degree of tension. It is the degree of tension on the ventricular muscle when it begins to contract. It is considered to be equal to end-diastolic volume. That is the volume as already defined. It is the volume of blood in the ventricles after filling phase. Then is the afterload. Afterload, as the name indicates, it is the load against which the ventricular muscle exerts its contractile force. Basically, it is the pressure. It is the pressure in aorta leading from ventricles. Thank you very much, dear students. With this lecture, we have come to an end with the events that occurs during the cardiac cycle. In the next lecture, we will study the regulation of heart pumping that occurs during cardiac cycle. Thank you very much.